Good afternoon. I'm Dr. Vasyl Chaika, and today I'll tell you what diabetes is. What are the first signs that people tend to ignore? What should you do to prevent diabetes? And what can you do if you already have diabetes? So let's get started. Diabetes is a disorder of glucose metabolism in our body. This happens when the glucose level either rises, for example, or drops. Yes, it might sound strange to you because you've always heard, for example, that with diabetes, blood sugar goes up. That's not quite right. With diabetes, blood sugar can also drop. And now we'll go over why these conditions occur. So, the metabolism of glucose in our body is controlled by just two hormones, which are produced by the pancreas. One hormone, insulin, removes glucose from the blood and transfers it into the muscles so that the muscles can use glucose for energy. And the other hormone, glucagon, does the opposite. It releases the glucose reserves, which are stored as glycogen in the muscles and liver, into the blood. So, glucagon increases the amount of glucose in the blood while insulin decreases it. Both of these hormones are secreted by the pancreas. But what's important? It's not the gland that decides which hormone to release, but our brain. And in our brain, in the frontal lobe, on the right side here is the center that controls the beta cells of the pancreas, meaning it regulates insulin levels, and on the left is the center that controls the alpha cells, which manages the production of glucagon. There's a very interesting fact that each of you can check for yourself. For example, in diabetes mellitus, whether type 1 or type 2, if you undergo a CT scan, you will always find corresponding changes specifically in the frontal lobes, which I will tell you more about shortly. Let's now look at some examples together to understand how these hormones work. And so, for example, when we are just sitting calmly, nothing is happening to us, and we don't need to do any physical work, our blood sugar level is always normal. But what if, for example, we need to do some hard physical work, or say, argue with someone, or for instance, a soldier needs to charge into an attack, or on the contrary, needs to hide in a trench? It doesn't matter whether we need to perform some active or passive action, we need quick energy for that. And this energy is provided to us by glucose, and the level of glucose in the blood is regulated by two hormones, insulin, as we've already discussed, and glucagon. It is a misconception that the pancreas itself determines which hormone to secrete, or that food influences which hormone is released. No, it is your brain that determines which hormone to secrete. An interesting and unique feature of how our body works is that in all the organs and tissues of our body, glucose enters only with the help of the hormones insulin or that same glucagon, but only in one organ, or rather in the centers that control the brain, which I mentioned earlier. Glucose gets there without insulin and without glucagon, that is, directly. This is a very important point regarding the sensor. It controls the glucose level in order to analyze what decision to make directly, while for all other organs, glucose enters through so-called transporters. So from the perspective of a comprehensive approach that takes into account not only the functioning of the physical body, but also the work of our brain in how a person perceives the world, why does diabetes occur? Of course, we've all heard that for some reason, the pancreas starts producing less insulin. Or, for example, there is a condition called insulin resistance. And when our body produces little insulin, that's called type 1 diabetes. But when, for instance, there is a lot of glucose and also a lot of insulin, that's type 2 diabetes. But this doesn't answer the question of why this happens. What causes the pancreas to somehow change its function? The answer to this question is our brain. That is, as soon as the relevant center in the brain is activated, it immediately sends a command to the cells of the pancreas, either the alpha or beta cells, and it is they who decrease or increase hormone production. When does this happen? Maybe when you eat a lot of sugar. No. Sugar has nothing to do with it at all here. This happens when you find yourself in situations that you personally perceive as requiring you to fight, to resist something. I don't agree with that. In other words, it's your internal struggle. Let's break this down. For example, a grandmother comes over and tells her little grandson, who is 2 years old, "You have to eat semolina porridge because semolina porridge is tasty. That's how I was taught, I know, because I'm older." But the child doesn't want to eat semolina porridge, yet the grandmother uses her authority to make him do it. The child feels an internal struggle. I don't want to, I don't agree. This state can lead to an increase in blood sugar. Does the blood sugar rise because the child has developed diabetes? No. The sugar is needed so that the child can fight back. And if this process, of course, drags on and the child is constantly fighting with his grandmother, the blood sugar will remain elevated. Here's another scenario. For example, when a soldier lying in a trench is told by his commander, you have to run into the attack, but there are enemies just 10 meters away. He has to fight the enemies, to resist them. And so, even a second before he stands up and runs, just after hearing his commander's order, his blood sugar will spike to 25 to 30. If we were to test his blood at that very moment, would we say that he has diabetes? No. So, a rise in blood sugar is not a disease, it's a certain state that a person enters. And the essence of this state, the essence of the change in our surrounding world as perceived by our receptors, is struggle. A constant struggle with something or someone when our internal interests are not aligned with it. I don't want to listen to this. This goes against some of my rules, values, and beliefs. This is a very important point. In such a case, changes will occur. The center will be activated, it sends a command to the pancreas, and changes in blood sugar occur. This is the essence of it. No, food, let me repeat, neither sweets nor anything else. No, alcohol does not affect the pancreas in any way that would change blood sugar. But specifically when a person, let me repeat, or a child finds themselves in certain conditions that they perceive, even unconsciously, as constant struggle or readiness to fight, this will lead to an increase in blood sugar. Here's another example. There was a patient who was 92 years old, and this patient, she had high blood sugar and high blood sugar diabetes, was diagnosed in 1990. And since then, it's been more than 20 years. High blood sugar. So what was the problem if we analyze this situation with you from a comprehensive approach? In 1990, when the Soviet Union was collapsing, guys in crimson jackets with gold chains showed up, and some came in Adidas tracksuits. And these guys came and said, you have to pay us tribute. If not, we'll take away the stores you were managing at the time. It was a household services building. But she handcuffed herself to the door and said, only over my dead body. The guys took note of her and said, good for you, we'll be back. But back then, life was very short. People didn't live long. Gangs kept changing, and they never came back to her. But the main question then is, this event happened back in 1990. Back then, yes, you had to raise your blood sugar, but why is it that so many years have passed and the sugar is still high? And the answer is very simple. Are you asking it? The question is, tell me please, what are you still fighting against? What other battle are you preparing for? She answered this question very simply. Every mayor of Kyiv who comes in wants to take this building away, and I am the honorary director there. And I will not let them do it for as long as I live. There you have the answer, why a person is constantly fighting and why their blood sugar will always be elevated. Now let's go over the symptoms that indicate your blood sugar is rising. I am convinced that only a comprehensive approach, which includes working on the physical, behavioral, and perceptual levels, allows people to be healthy in today's world. There are real symptoms of diabetes or when blood sugar rises. So the first and most reliable symptom is that a person experiences thirst, especially at night. Why? Could this indicate a malfunction? No. The body always controls blood sugar levels. Remember, the control center is not in the pancreas but in the brain. That's why glucose gets there directly, without any hormones. When the concentration rises above 9 millimoles, the body activates the first defense mechanism. This is from Prague. The person drinks water and the concentration of glucose in the blood begins to decrease, the amount of plasma increases, and the glucose concentration drops. This is the first defense mechanism. If this mechanism is not enough and glucose continues to rise because the person keeps struggling and the brain's only task is to sustain life, it triggers the second defense mechanism. This is when the permeability of glucose through the renal barrier increases. And glucose appears in the urine. That's why you urinate. And the urine becomes sweet. In the past, that's how doctors checked for diabetes. How? They called it diabetes mellitus, meaning the urine was sweet. For example, insects would gather at the spot where a person had urinated, and they would congregate there, as they say, and consume the sugar that was excreted from the body. No one drank the urine. Those are just myths that a doctor had to drink urine to diagnose diabetes. No, it was simply an observation. These are two reliable symptoms. Now, there are also symptoms that people mistakenly consider to be reliable. So, the first is when pigmentation increases in certain areas, or what is called acanthosis nigricans. For example, they say that pigmentation appears here, on the back of the neck. Or for example, it could be somewhere in another part of our body on the surface of the skin. And what does this have to do with the loss of melatonin production? Here, melanocytes. Why is there an error here? Because insulin and glucose have no effect on this at all. It's just from the word no way. And the only truly correct and significant sign here to observe is that with the presence of diabetes, a noticeable dryness and a slight yet distinct pigmentation may indeed appear right here on the skin. Here. Why? Because the projection area of the elbows is the center that indicates that this is the projection zone of the pancreas and nowhere else. Second point, they say that papillomas appear. This is supposedly the reason why we have diabetes. In other words, it's an early hidden sign. Where is the mistake here? They say that insulin itself is an anabolic and it stimulates growth. But the papilloma is the growth of the flat epithelium of the epidermis, of the skin. And its control is not carried out by the pancreas at all. And there are a huge number of people who have normal blood sugar. And they have papillomas. So this really undermines all these theories. The next mechanism, or rather, the next feature is that the skin becomes very dry and very dense. And again, is this a problem of sugar and insulin? No. Dryness of the skin, specifically the epidermis, and thickening of the skin do not depend on blood sugar levels or the function of the pancreas, because it is actually the liver that affects this. And here is a very characteristic feature in people who, for example, have fatty liver disease, or cirrhosis of the liver, or chronic bile outflow disorders. You will notice that they have dry skin, extremely dry skin. But for example, in people who have kidney dysfunction, their skin, on the contrary, is not dry, but very moist. Therefore, this is not a diagnostic sign of elevated blood sugar. The next symptom is acne, the appearance of acne. It is said that, for example, the same insulin, it stimulates androgens, and this leads to the appearance of acne, especially in women with polycystic ovary syndrome. Insulin does not affect polycystic ovary syndrome in any way. And in order for polycystic ovary syndrome to develop, a person needs to be in a completely different specific condition. And you can easily check this. For example, if you are afraid of losing your husband or your wife, or say you are afraid of losing your child, really afraid that they might die, or for example, a pet, a cat or a dog, only then will you develop polycystic ovary syndrome. This is a reflex reaction. But when you have a feeling of struggle, when you feel you have to fight internally because you disagree with something, then it won't occur. Polycystic ovary syndrome. Instead, you will experience elevated blood sugar. This is called a reflex reaction. The next false statement is that insulin reduces the functioning of the immune system, or that high blood sugar reduces the functioning of the immune system. And for example, a Baker's cyst may occur, the same thing, or a Tarlov cyst, the same mistake, because insulin and glucose cannot affect adipose tissue. The only task of insulin is to transfer glucose from the blood to the muscles. He is like a key that opens a door, and nothing more. The next mistaken claim is that insulin, for example, and elevated glucose lead to atherosclerosis and blood vessel thrombosis. And, for example, conditions like gangrene and trophic ulcers are seen in diabetes mellitus. And this is considered a sign that we have diabetes. This is again a mistaken claim. Why? The glucose level, even if it is 40 millimoles, does not lead to blood thickening. And you can very easily check this yourself. Glucose in the blood does not affect the aggregation of blood cells, that is, the thickening of blood cells, in any way. Not at all. You can make sweet water and see if anything changes. You can use blood cells. There you can try to behave differently somehow. No. Blood thickening depends on whether red blood cells stick to each other or not. And this is directly influenced by the properties of blood plasma, the presence of negative charges there, not the presence of sugar in the blood. These are those false statements. When people often come across them, they self-diagnose and are more likely to diagnose themselves with disorders of completely different organs, but they think it's diabetes. But there is one more very important point. As soon as they start fighting something very intensely, for example, fighting an illness or symptoms, their blood sugar will also rise. Why? Because for our brain it doesn't matter whether you are actually fighting something or just battling it in your head. You will always have a high demand for energy. And this need for energy comes from somewhere. Where? From glucose. It's the fastest source of energy. So where does the body have to store it then? Of course, in a source that can deliver it to any organ as quickly as possible. That's the blood. This answers the question, why does the glucose level rise specifically in the blood and not, for example, as glycogen stores in other organs? Now let's move on to what needs to be done. When you clearly understand that the cause of changes in blood sugar is not a malfunction of the pancreas, but rather the conditions a person finds themselves in and perceives as, I have to fight, I have to resist, I do not agree with this decision, or with this behavior, the best way to lower blood sugar and to turn off the reflex reaction is to stop fighting. That is, if it's a child fighting with a teacher at school because the teacher unfairly gives them a low grade, then change the school. If this struggle is happening between a child and a parent, then of course the parent needs to change their attitude toward their child. If this struggle is happening in some children's group or, for example, at work, then you need to change this environment. Those who then, by changing the conditions, the body will gradually restore the blood sugar level on its own. I want you to understand this. The second very important element is emergency aid measures. And for emergency aid, of course, insulin should be used here. But after administering insulin, you need to work on managing emotions. There's a very interesting fact. It is said that glucose should be excluded because when someone has diabetes, they crave sweets. Why do people crave sweets? Have you ever thought about this? It's because the body needs to accumulate reserves of glucose. We get all these substances from outside, so the body creates the conditions for it. You start craving sugar, you want that sugar. Of course, if you limit sugar, for example, by following a keto diet or even living completely without sugar, then we simply don't give the body sugar, and it won't be able to raise its levels because the body can't synthesize sugar on its own. This is also one of the methods, but it does not eliminate the cause. The cause is always a change in the environment in which a person lives. And here is a very interesting trick. It is often said, for example, that alcohol lowers blood sugar. When a person drinks alcohol, their blood sugar drops. Why does this happen? Maybe alcohol somehow affects insulin? No. When a person drinks alcohol, they lose their sense of reality. Through vision, hearing, and smell, the events happening around them become unimportant. At that point, it doesn't matter what your dad, mom, grandmother, teacher, friend, or boss says. It doesn't matter. And since it doesn't matter, there's no need to fight. And as a result, during this period, while it doesn't matter to me, my blood sugar starts to return to normal. That's the answer to this question. You can't give alcohol to children. You need to change the circumstances. Adults, I want you to understand why this situation arises. I even had one interesting case. Let me tell you about it. There was a sea captain who had diabetes for 10 years, and he said, "Doctor, I'll tell you a very secret method for lowering blood sugar." He said, "Every time I drink myself unconscious, the next day I go in for tests and my blood sugar is normal. But then, when the alcohol leaves my system, the sugar goes up again. See, that means vodka is good and you should drink more of it." But when I explained to him how it actually works, he was a bit disappointed. That's why you need to know how this works and help your body the right way. Only by using a comprehensive approach in today's world can you stay healthy.